Hi, good evening. I'm Dr. Philip McMillan, and thank you for joining me as I try to do a scientific analysis on whether or not smoking reduces COVID. What an odd thing to say. Why would I even think about it? Well, largely because I believe that science is about observation and then using that observation to try and make interpretation. So here is the definition: the observation, identification, description, experimental investigation, and theoretical explanation of natural phenomena. That's what I'm talking about. So, in the context of any question around COVID 19, my question is not whether or not it should be right or wrong, but just is it right or wrong? And if it is right, then why? And so, in this scientific analysis, I will be showing a few things that I think are quite relevant. And one of them is the fact that I'm going to be highlighting the country Belarus. And this here is an example of the things I'll be going through. I'll be looking at the impact of tobacco smoking on COVID 19. I'll be looking at the myth, apparently, in Nature magazine, and just covering a few points with regards to what I think could be the explanation as to why we ended up with that discussion. And more importantly, what does it teach us in relation to the next phase of the pandemic? As you know, I'm always preparing and I'm always looking for answers. And I'm one of those people who does not assume the pandemic is over. I am always assuming the worst and therefore trying to find solutions that can make a difference. In that line, if you are interested, coming up in another 2 weeks' time, how to prepare for the next wave of COVID. So, this is for people who are interested in understanding what I'm talking about, and the link is in the description. All I'll be talking about here is I'll be taking apart each and every one of the things that you may have heard is beneficial, that is accessible to you. And I'll explain from a scientific perspective, especially with regards to my autoimmune research and just the basic mechanism of how the virus works. How could something help? And what are the potential downsides? Upsides and downsides. That's the way how medicine operates. So let's get back to this question about smoking and the reduction of COVID. It was an odd thing, you would think. Where would something like that even come from? Who would think about even talking about this? Well, it came from a paper that was done here in France, I think it was. This here, the impact of tobacco smoking on the risk of COVID 19, a large retrospective cohort study. This was done in 2021, January 2021. So this was just after the first and second waves. Essentially, they were hearing that smokers could be less susceptible to coronavirus, which causes COVID 19. And they were interested in that question. Let's be clear about something here. Under no circumstances am I encouraging smoking, because smoking has a whole lot of health risks, including lung cancer, cardiovascular disease, cardiometabolic disease. It can lead to damage to the airways, emphysema, COPD. There are a whole litany of diseases that smoking causes problems for. And most of our work clinically is trying to encourage people who are unwell to stop smoking. So, this is not about a promotion of smoking. This is about just simply trying to understand if it had an impact. What was that impact? What was the science behind it? And how can we apply the science currently to try and see if we can make a difference? So, let's look at what they did in this study here. So essentially, this is looking at the methods. They found an aircraft carrier. This is the aircraft carrier's crew had COVID 19. This was in January 2022 to April 2013, 2020. It was just part of an operational mission. Then they had a SARS-CoV-2 epidemic on the ship, requiring 2 weeks to return to Toulon, the main harbor. And then they took all of the soldiers, 1,769, did a physical examination, and then started doing nasopharyngeal samples once they arrived. And they were just looking to try and understand that simple question. When they actually assessed the reality of what was going on, did they find a lower risk of smoking in these soldiers? That was the essence of it. Really simple question. And essentially, what they found out is that when they went to their results, and I'll show you this here again, in the results, among 1,688 crew members, of which 87% were men, they found essentially, let me just look at the conclusion here, that current smoking status was associated with a lower risk of developing COVID 19, but cannot be considered as efficient protection against infection. The mechanism requires further research. That's excellent. That's exactly what they should have said. So they're not promoting smoking, but they're very interested in the mechanism. Listen, science is about curiosity. It's about seeing things that don't make sense and then trying to find answers for them. So this is purely my exercise as to, well, what could be the mechanism, and if it's true, how would this play out? So I'm now going to show you a world map, because my next question was, if this is true, then I should see it in the context of the world. And here we have a picture of the world, and it shows you the countries that have the highest level of smokers. And in dark blue here, standing out in the middle here, is Belarus. Next in line is Russia. And I think down here you have Albania, and as well you have Syria. So those are some of the countries that have very high levels of smokers. So I then looked at Belarus and I thought to myself, well, if this is relevant, I wonder what happened in the context of Belarus. Did they have a major problem with regards to COVID 19 with so many people smoking? Well, again, when I looked at the world, this is the world in data, they were looking since 2020 at cases across Belarus. And you see a spike here, and you're talking about daily confirmed cases, 900 cases, and then it continued along like this all the way until the Omicron peak here went down, and then it's flat. So we can see that Belarus, for whatever reason, had a relatively low number of confirmed cases with regards to COVID 19. Now, it doesn't mean that this is necessarily just because of the fact that they smoke, but whichever way we take it, when you look at the cumulative number of cases, you can see that Belarus has had a flattening over this period of time. They are flat here since May, August 2022 into 2023. So something is happening in Belarus that the rest of the world should actually be thinking about. How can that be happening there when across the rest of the vaccinated world, they're having high numbers of Omicron cases spreading across the world? So we need to think carefully what could be the science. Again, this is a BMJ article, and this was in 2020. And again, they picked out COVID 19. How does Belarus have one of the lowest death rates in Europe, even though they have one of the highest smoking averages? And they were looking at the mechanism for it in this here. They had a low death rate, and they are thought to be having, because Belarus' large hospital capacity could be a factor. It outnumbered nations like Germany and the UK. Um, and they did quite a lot of testing early on, mass testing during the first 4 months of the pandemic. So there are a number of things that Belarus had done which were quite good and quite forward thinking. And maybe that had an impact on the fact that they had relatively good outcomes in the pandemic. So, counter to this is the fact that we have the WHO, which clearly says, on the other hand, smoking increases your chances of getting COVID 19. So, this is the balance. And they are saying this is because of a number of factors. Two factors, they say: smokers and tobacco users are at greater risk of contracting COVID 19. Why? Because they bring their hands to their mouth more frequently, increasing the chance of infection. Chewing tobacco produces saliva and increases the urge to spit, which can lead to environmental risks. Additionally, smoking can give you severe symptoms because smoking damages the lungs and other organs of the body. So, in effect, quite rightly, in the context of smoking, because the WHO doesn't want to encourage anyone to smoke, they were against this idea that smoking could be of any benefit. But again, I have to say, the thing about science is that it doesn't matter what you see, even if it's completely opposite to what you expect, you have to be responsible to investigate it. You don't discount it. So, again, let's look at another paper here. And this one was from 2021. Are smokers protecting against SARS CoV 2 infection? The origins of the myth. And they were talking to the fact that a number of recent studies found low percentages of smokers among COVID 19 patients, which made them conclude that smokers may be protected against SARS CoV 2 infection. They completely disagree with that. And in the article, they shed the light on the process that led to the misinterpretation of observational research by scientists and the media. They look at the methodological flaws of various studies with hasty conclusions. And finally, they address the role of primary care providers in mitigating consequences of erroneous claims. So I guess they would be saying that me even talking about this would be one of those erroneous claims. But me, I'm looking for the science. I'm just trying to understand the science because if I understand the science, then I can apply the science in a way that makes logical sense. So let's now look at what I think is the relevant science about this. The first thing you have to do is understand how the virus works. This here is a picture of an image from a Cell paper that was published in early 2023. It was a brilliant paper. They infected human organoids with ACE2 and they observed carefully what exactly the virus did. And they showed in terms of time frames 6 hours, 24 hours, and 48 hours. And at this point, you can see that the virus binds to the cilia, the motile cilia that sweep mucus along. So this area here, and I'll show you with a pointer. So this is the motile cilia sweeping the mucus. So this cream area is representative of mucus. This light blue area is representative of air. The virus then comes in, binds to the motile cilia, and then it causes the virus to go down and then it gets inside the cell. Once inside the cell, the virus then replicates. But in order to spread, it then makes these microvilli here on the surface of the cells in the upper airway become like trees. And does this through a protein pack 1 and pack 4. It's a separate conversation about that. But it then makes them stick above the mucus, and then this will subsequently spread from either into the lungs or otherwise within 48 hours. So this is how the virus works. So the critical thing from a practical point of view is that mucus is an essential part of that process. And understanding how the mucus fits into it is critical to understanding what the mechanism is that smoking can have an impact. Because when you look again, and this is taken from Everyday Health, it shows here this image of how smoking harms your sinuses. And they say they know, smoking is bad for you, but cigarette damage isn't just confined to the lungs and throat. It also damages the sinuses. But critically, it says that because the membranes in the nose and sinuses are constantly producing mucus, that acts as a protective blanket for your whole respiratory system. That's the bit that is extremely important to understand. In effect, what we're having here is that smoking is increasing the risk or increasing the amount of mucus that is being produced. And that increase in the amount of mucus is impacting on the ability of the virus to get to bind to the motile cilia, get down into the cells, and critically, even to get out of the cells. So, all of these things are extremely important in understanding the mechanisms as to how something that seems to be completely negative could still be working to produce benefit. So, this is where the science comes in. You observe, you identify, you reflect, and then not only do you produce theoretical explanations, you then think, how can you use this particular observation to then bring benefit to people in terms of reducing risk of infection? And again, it comes back to the simple things. If you therefore increase the mucus in the upper airway, you could then impact on the ability of the virus to get into the cells and to get out of the cells. Just slowing this process by even a day could make a huge impact on the speed or the immune system being able to respond quickly to the infection. That's why I would say if smoking reduces COVID, it is probably because of the fact that smokers are producing more mucus, and that excessive mucus impacts on the ability of the virus to spread, to infect, and to spread. You have to remember that smokers, if they've been doing it for a long period of time, would be at increased risk of cardiometabolic disease, which is the major risk factor in terms of severe COVID 19. So it would depend on the timing and the comorbidities of the person. But again, this is not about smoking. This caused me to think very carefully as to whether or not there was a way to increase the upper airway mucus production. Could this be done by nebulization? Could this be done by nasal sprays or even nasal irrigation? Could this be done by using even something like a vape, producing a vapor that increases mucus production without damaging the lungs? There are all these options that could be available if we reflect on the science, as opposed to just simply sticking to what we think people should hear. That's where science gets lost because we stop observing and we start to only think in very tight boxes. So, again, if you are interested in listening to how I explain how some of these simple mechanisms could be beneficial, register for the webinar. I would really like to go through each thing step by step and say why I think this probably works, why it won't help here. Critically, in the context of Omicron, not only is it upper airway, but it is the sinuses as well that have to be protected. That in itself is a whole different discussion. I hope this was valuable, and I look forward to seeing you again or speaking to you again in the near future. Have a great day.